Hi, good morning. So I'm here to perform a nasopharyngeal suctioning. So first things first is make sure we check the patient's chart. Make sure we obtain information such as if we should know if the patient just came from any surgery, which might be contraindicated, especially from in the patients doing facial surgery. Sorry. So once everything's done, go inside to the patient's room. Make sure we sanitize first our hands, introduce ourselves to the patient, to the staff if present, and even the relatives. Explain to them what's the purpose of this and what's the benefit of the work of this what they're going to do. So after that, make sure we check the patient's ID band to know if they're the exact correct patient. And then do our patient assessment, obtain vital signs, auscultate, and then check the SpO2 level and everything. So once everything is done, we're going to wear appropriate gloving and PPE, such as a gown, a face shield, or even for our hair, just in case if there are any secretions, multiple secretions present, or even blood to prevent us from being contaminated. So once everything's done, we make sure we have the suction bottle in place and the regulator. So inspect for any cracks present or even misconnections after is turn on the regulator, and then make sure the tubings no obstructions or kinks, and then we have to set the pressure for about -120 to -150, and then we have to know the exact amount of pressure by obstructing it. If we sense that the pressure was too much, we just have to twist this one and then turn it, and then we check again. So after this, we have here a nasopharyngeal airway. So first is we inspect both nostrils for any obstruction present or any deviated septum, and then when inserting this one, we have to lubricate it with a lubricating jelly, and then with this we will know appropriate size by measuring it in the earlobes until the tip of the nose, or we can inspect it just by the edge or the hole if it's just too small or too big for the patient. So when inserting this one, make sure we insert it with ease or gently, and then we facilitate it by inserting it with, if we sense any restriction, we have to insert it gently with a gentle twisting like that until we are able to put it truly inside. So if we sense more than once any restrictions, so the best way to do is we have to make sure we replace it with a different size, or we can have to put it in the other nostril. So once everything's done, make sure we have an oxygen device in here, and then we must let the patient hyperoxygenate, and then make sure we inspect the bag if it's fully inflated. So we have to put it to the patient, assuming it's fully inflated, allow the patient to hyperoxygenate, and then prepare the necessary supplies. With the necessary supplies, we have here the nasal catheter. We also have the sterile gloves. Make sure it's fully open, not able to touch even the table or anything else. Make sure you maintain sterility. And then we have here a lubricating jelly. With the lubricating jelly, we have to put it in the cover of the basin, or if possible we have a clean gauze present, and then we make sure have a sterile water, pour a adequate amount to the catheter, make sure it's being sterilized. So once everything's done, wear the sterile gloves. Once everything's ready, we have to choose which one is our dominant hand. So if this is my dominant hand, this one is where I'm gonna hold with the suction tubing, and then this is where I'm gonna hold with the catheter. So we will know if there's a hissing sound to know its functionality, but other than that, we have to make sure we suck a adequate amount of suction sterile water to know if it's functioning also, if we notice there are adequate water coming in the catheter. And then after that, make sure you lubricate it. And then with a lubricating jelly, it would help insert with ease gently to the airway. So insert it gently to the patient's nose, and it should not be more than 15 seconds. It should be